Did you know that 1 in 4 older adults over 65 experiences a fall each year? And surprisingly, medications causing balance problems are one of the leading triggers of these dangerous incidents. But it's not just seniors. Millions of people, regardless of age, deal with dizziness, lightheadedness, or loss of coordination because of the prescriptions they take. Welcome, I'm Dr. Oliver, and today we'll uncover 10 common medications that can secretly affect your balance, plus what you can do to stay safe. Before we start, pause for 2 seconds. Hit subscribe and turn on the bell so you never miss life-saving health tips that keep you strong and steady on your feet. From blood pressure medications to pain medications and antidepressants, some drugs can slow brain function, interfere with muscle control, or disturb the inner ear, a key part of the vestibular system that keeps you balanced. Studies even reveal that nearly 40% of fall-related hospitalizations are connected to medications that impair stability. In this video, we'll uncover 10 common prescription drugs that can secretly affect your balance, and what you can do to stay steady on your feet. Some of these might already be sitting in your medicine cabinet, so make sure to stay with us until the end to learn how to protect yourself. 1. Sleep aids. Many people turn to sleep aids like Ambien, Lunesta, or over-the-counter options such as diphenhydramine, found in Benadryl and various nighttime pain relievers. While these drugs can help you fall asleep faster, they also make you feel groggy, dizzy, or unsteady even the next morning. This happens because many sleep medications slow down the central nervous system, affecting coordination and reaction time. Some people even describe a sleepwalking sensation or a hangover effect after waking. For older adults, this is particularly risky, as it raises the chance of falls and serious injuries. Even so-called natural options like melatonin or valerian root can cause drowsiness in sensitive individuals. If you start noticing balance problems, speak with your doctor about safer alternatives. Practicing good sleep hygiene, reducing screen exposure before bed, and keeping a regular sleep routine can be just as effective without unwanted side effects. And if you rely on sleep aids, be extra cautious when getting up during the night. A fall in the dark can be dangerous. 2. Blood pressure medications. High blood pressure is often called the silent killer, so it's no surprise that millions depend on beta blockers like metoprolol, diuretics like hydrochlorothiazide, and ACE inhibitors such as lisinopril to manage it. While these heart medications are life-saving, they can also cause dizziness, fatigue, and an increased fall risk. Here's why. Beta blockers slow your heart rate, which can make you feel lightheaded when you stand too quickly. Diuretics lower fluid volume to reduce pressure, but this can lead to dehydration and electrolyte imbalance, leaving you weak or unstable. Some ACE inhibitors may trigger orthostatic hypotension, a sudden drop in blood pressure upon standing, a common cause of loss of balance in older adults. To minimize risk, stay hydrated, rise slowly from sitting or lying positions, and monitor your pressure regularly. Never stop your medications abruptly, but if dizziness becomes frequent, your doctor might adjust the dosage or recommend a different approach. Quick check-in. Are these explanations helping you understand your medicines better? Type 1 if yes, or 0 if you'd like other topics next. Your response tells me what to break down in future videos. 3. Antidepressants. Antidepressants are vital for many battling depression or anxiety, but some, particularly SSRIs like fluoxetine and sertraline, SNRIs like venlafaxine, and tricyclic antidepressants such as amitriptyline, may increase the risk of dizziness and falls. SSRIs and SNRIs alter serotonin levels, which can influence blood vessel tone and sometimes lead to irregular heart rhythms or mild increases in blood pressure. Meanwhile, tricyclic antidepressants can cause orthostatic hypotension, meaning your pressure drops when you stand up, increasing your fall risk. Research even suggests long-term use may slightly elevate the chance of heart disease or stroke, especially in those with existing cardiovascular conditions. But this doesn't mean you should stop your treatment. Mental health is just as crucial as heart health, and for most patients, the benefits outweigh the risk. If you have a heart condition or frequent dizziness, talk to your doctor about safer alternatives or possible dosage adjustments. 4. Diabetes medications. Diabetes medications are essential for controlling blood sugar, but some can trigger sharp drops in glucose levels, hypoglycemia, leading to weakness, confusion, and loss of balance. This is most common with insulin and sulfonylureas, including glipizide, glyburide, and glimepiride, which stimulate insulin release from the pancreas. Studies show that around a quarter of emergency visits for hypoglycemia involve people using these drugs. When blood sugar drops too low, the brain doesn't receive enough energy, causing blurred vision, confusion, and dizziness, all of which dramatically raise the fall risk. If you take diabetes medications, monitor your sugar levels closely, eat balanced meals, and avoid skipping food when medicated. Recognizing early symptoms, like shakiness or sweating, can prevent serious complications and keep your balance and coordination intact. Additionally, some newer diabetes medications, such as SGLT2 inhibitors like Jardiance and Invokana, may cause dehydration and low blood pressure, making it harder to stand balanced when standing too quickly. If you're taking any diabetes drugs, it's crucial to monitor your blood sugar often and recognize early hypoglycemia warning signs, like sweating or confusion. Type 1 if you're following, and hit the thumbs up button so more people can stay upright and safe. 5. Heart medications. Heart medications are vital for managing high blood pressure, heart disease, and arrhythmias, but some can interfere with your stability and raise your fall risk. Beta blockers, including metoprolol and propranolol, along with calcium channel blockers such as amlodipine and diltiazem, lower blood pressure and slow heart rate. This can cause dizziness, fatigue, or lightheadedness, especially if you rise suddenly. A study published in the Journal of the American Geriatric Society discovered that older adults using blood pressure medications faced up to a 30% greater chance of serious falls. The risk becomes higher when these drugs cause orthostatic hypotension, that sudden drop in blood pressure when changing positions, which leads to dizziness and instability. In addition, diuretics, or water pills, like furosemide and hydrochlorothiazide, help eliminate extra fluid, but may also flush out essential electrolytes, including potassium and sodium. Losing these minerals causes muscle weakness, leg cramps, and coordination issues, making falls more likely. To minimize risk, always stand slowly, remain hydrated, and monitor your pressure regularly. If balance issues or dizziness persist, your doctor may modify the dosage or suggest alternative heart treatments. 6. Anti-anxiety medications. Anti-anxiety medications, especially benzodiazepines such as Xanax, Valium, and Ativan, are often prescribed for anxiety and panic disorders. These drugs act by increasing the effects of GABA, a neurotransmitter that calms the brain. While this helps control anxiety, it also produces drowsiness, dizziness, muscle relaxation, and slower coordination, all of which raise your fall risk. Research indicates that older adults taking benzodiazepines are at least 50% more likely to experience falls and fractures than those who don't use them. But age isn't the only factor. Anyone taking high doses or using them long-term may notice delayed reaction time and trouble maintaining balance. Besides benzodiazepines, other anti-anxiety medications like buspirone can also cause lightheadedness and dizziness, especially when standing up suddenly. Combining these drugs with alcohol, pain medications, or sleep aids can worsen the effect, making balance problems even more severe. If you rely on these medications, talk to your doctor about finding the lowest effective dose or exploring non-drug remedies such as therapy, yoga, or breathing exercises to manage anxiety safely while lowering your fall risk. 7. Antihistamines. Antihistamines are commonly used for allergies, colds, or nausea, but they can also reduce coordination and impair balance. First-generation antihistamines, like diphenhydramine, Benadryl, and chlorpheniramine, work by blocking histamine, but they also affect the central nervous system, leading to drowsiness, dizziness, and delayed reaction times. A study published in the Journal of the American Medical Association found that older adults who used first-generation antihistamines faced a 20–30% higher risk of falls due to their sedative effects. These medications can also blur vision and reduce spatial awareness, making it easier to misjudge steps or obstacles around you. Second-generation antihistamines, including loratadine, Claritin, and cetirizine, Zyrtec, are generally less sedating, but can still cause dizziness or lightheadedness in certain individuals. The risk increases when these drugs are combined with other medications that also induce drowsiness, such as sleep aids or anti-anxiety medications. To minimize fall risk, try to avoid first-generation antihistamines whenever possible. Choose non-drowsy alternatives, and if necessary, take them at night. If balance issues continue, speak with your doctor about alternative options to help prevent dangerous falls. 8. Pain medications. Pain medications, including opioids and some over-the-counter pain relievers, can greatly influence balance and coordination. Opioids like hydrocodone, oxycodone, and morphine act on the brain to reduce pain signals, but also depress the central nervous system, causing drowsiness, dizziness, and impaired motor control. A study in the Journal of the American Geriatric Society revealed that opioid use in older adults is linked to a 68% greater risk of falls and fractures. These drugs may also lower blood pressure, which further raises the chance of losing balance when standing up suddenly. Even non-opioid pain medications, such as NSAIDs, ibuprofen, Advil, and naproxen, Aleve, can contribute to dizziness, especially for people with low blood pressure or sensitive stomachs.
At higher doses, they may affect kidney function, causing fluid imbalance and lightheadedness. To stay safe, use the lowest effective dose, stay hydrated, and never mix opioids with alcohol or other sedatives. 9. Antibiotics. Antibiotics are essential for treating bacterial infections, but certain kinds can interfere with your balance and coordination. In particular, aminoglycosides such as gentamicin, tobramycin, and streptomycin are known to be ototoxic, meaning they can damage the inner ear, which controls balance.
Research indicates that nearly 20% of patients treated with aminoglycosides experience vestibular toxicity, which leads to dizziness, unsteadiness, and sometimes permanent vestibulopathy, a chronic sense of imbalance. These drugs can injure the vestibular nerve, which transmits signals from the ear to the brain. Similarly, fluoroquinolone antibiotics like ciprofloxacin, Cipro, and levofloxacin have been connected to neurological side effects, including dizziness and nerve damage. In some cases, they may also lower blood pressure, making sudden movements feel disorienting. If you notice dizziness or balance problems while taking any antibiotic, tell your doctor immediately. They can adjust your dosage or prescribe a safer alternative. 10. Parkinson's medications. Drugs used to treat Parkinson's disease can also strongly affect balance and raise the risk of falls. Parkinson's itself impairs movement and coordination, and certain treatments can worsen these effects. Levodopa, Sinemet, the most common Parkinson's medication, helps restore dopamine levels in the brain, improving mobility. However, it can cause orthostatic hypotension, a sudden drop in blood pressure when standing, resulting in dizziness and increased fall risk. Studies show that up to 50% of people with Parkinson's experience this issue. Dopamine agonists such as pramipexole, Mirapex, and ropinirole, Requip, can also lead to sleepiness, dizziness, or even sudden sleep episodes, making activities like walking or driving unsafe. Additionally, anticholinergic drugs used to control tremors, including benztropine, Cogentin, may cause confusion, blurred vision, and unsteadiness, further impairing balance. If you or someone you care for is on Parkinson's medications and frequently experiences dizziness or falls, talk to your doctor about adjusting the treatment plan. How to stay steady and prevent falls. If you're taking medications that affect balance, there are proactive ways to lower your fall risk. Start by speaking with your doctor or pharmacist about your current prescriptions. Ask if any could be causing balance issues, and whether dosage adjustments or alternatives could help. Stay hydrated. Dehydration worsens dizziness, especially when using diuretics or blood pressure medications. Stand up slowly after sitting or lying down to avoid blood pressure drops that trigger lightheadedness. Use handrails on stairs and keep your home clear of tripping hazards like rugs or clutter. Practice regular balance and strength exercises, such as Tai Chi or gentle yoga, to improve stability. Wearing supportive shoes and, when necessary, using assistive devices like a cane or walker can provide extra confidence and prevent falls. Lastly, review your medications regularly with your healthcare provider. If you experience new symptoms like weakness, dizziness, or unsteadiness, report them immediately.
Small adjustments can make a major difference in keeping you safe, steady, and independent. Before you go, subscribe and turn on notifications for more trusted health guidance to keep you independent and secure. Tell me below which medicine surprised you most, or share your own experience. Your comments inspire us to create life-saving content. And please share this video with someone you care about. Staying informed means staying steady and staying safe.